The broadcast is now starting. All attendees are in listen-only mode.
Good morning and afternoon. This is Peter Eckert. I'm the director of the Center for Health and Information Technology at the Illinois Public Health Institute. And together with Claire Tanner at the Michigan Public Health Institute, we are the co-directors for Data Across Sectors for Health. So on behalf of Claire and the rest of our team, we want to thank you for taking the time to participate in this informational webinar. The key activity here is to be thinking about the questions that you have as I go through the materials. This is not like some of the webinars that DASH does, where we've got communities on board that are sharing their wonderful lessons and experiences. This is really the DASH program office providing an opportunity for potential awardees in the Kickstart program to get information to make the best possible application. If you do have any technical issues, Jenna Frickovich's email address is on the screen right now. And since you can hear my voice, I'm going to assume that everything is okay. So the primary way that you'll communicate your questions to us is through the question area on the bar on the right of your screen. And so please feel free to ask questions at any point. Questions that we have members of our team online. If we can answer them in the question box while we're going through, we will. Otherwise, I'll try to answer as many as we can at the end. It's important to note that we will have an FAQ that's posted at the Dash Connect website. So there's already a bunch of questions that are there because this is the third round of Kickstart. So we do have some experience in anticipating what some of your questions might be. So that's a great place to start. And I'll get started. So as I said, this is the third round for the DASH Kickstart program. And so some of the information that we share today will be new. The program has not changed that much from when we did it the last time, which was back in April. And so just as an overview, for those of you who are not super familiar with DASH already, DASH sort of has three buckets of activities that we think about for our work. And the first is to build capacity in local communities where there are multi-sector collaborations working to share data. And the second bundle of activities is related to building the evidence base. And our primary mechanism for building the evidence base is the work that we do with our grantees and awardees. So those two things are connected very intimately. The third thing is that we do quite a bit of strategic networking. And I think this is true for a lot of national organizations, but it's especially true for DASH because we're one of the founding organizations for something called All In, Data for Community Health. So All In, Data for Community Health, you can learn more about them at our website at dashconnect.org, but also at the All In website at allindata.org. And so All In Data for Community Health is really about building a bigger national collaborative network for folks around the country who are doing this kind of work, locally based, multi-sector in approach, and focused on data sharing to some degree. So I know this is a little bit complicated for folks who haven't really been relating to All In at all, but this is one way to think about it. The DASH and the other program offices that make up All In, we focus on what's happening in the local collaboration around data sharing, multi-sector partnerships, and collaboration. On a national level, All In is really about a movement. I use that term a little a little bit tentatively because it's not a movement like a social movement, but it is reflecting the way that health and healthcare and human service providers are recognizing just how important are the social forces that determine health. And so we are inside that, the way that the systems are changing to reflect our understanding of how health is generated. Again, the all-in is really focused on the evidence base in the same way that DASH is, but DASH we had 10 original grantees, we've had 2 rounds of Kickstarts, that's about 10 grantees, so that's 20 grantees. That's a lot, but it's not the same as the fact that all-in has funded among its many partners over 100 communities. And so the idea for all-in is to create a place where there's a lot more connections happening. So think of DASH as the first network and all-in as the larger network that a DASH is a part of. And also the third thing that all-in does, and we're kind of slowly moving into this space, is trying to figure out how do we use the knowledge and power that we're developing by having so many communities. So let me jump into the Kickstart program itself. As I just alluded to, DASH began with 10 big, relatively big, $200,000 grants to communities across the country, and we followed those folks for, in some cases, 2 years. The Kickstart community impact contracts, the Kickstart program is really about identifying opportunities where folks are working in community around collaboration, moving towards data sharing, and sort of saying, you know what, there are operations, there are opportunities, there are barriers to be overcome, there are things that are kind of right in front of our community that we think that we can solve with an infusion of cash. And so the Kickstart grants are $25,000. They're really intended to be executed in 6 months or as close to 6 months as you can. And it's to solve something that's pretty immediate. Now that we've done a few of the Kickstarts, we have some sense for what the potential activities are. So I'm not going to read the slide to you. Honestly, the slides that are here are available to you in that same dashboard. If you look to your upper right of your screen, you'll see that you can, if you see the link for handouts, that is these slides. But also, the slides are primarily taken straight out of the instructions for the Kickstart. So this should all kind of hang together. So we have identified over the course of this project different ways to use the Kickstart funds. A lot of times it's to augment existing staffing. So it's hiring a consultant or a technical expert or engaging with an organization or another community collaboration that has expertise or a tool or a process that will accelerate what you're trying to do in your community. I'll just say parenthetically that one of the things we're trying to do with Kickstart is to establish a regular process about the availability of these funds. So one of the common questions is, oh, this is round 3 of Kickstart. Will there be another round? Almost certainly there will be. We're expecting to do another round or maybe even 2 rounds in 2019. So it's entirely possible you may decide, you know what, we're not really ready to take advantage of this yet. You should feel comfortable knowing that you'll have another shot in 2019. We really do hope that people are applying for activities where there's both an immediate need / opportunity and sort of in a plan to address that. So lots of potential activities there. We're also, we have done 10 Kickstart contracts so far. I'm sure we have not exhausted all the potential uses of the funds. So don't be limited by the list that's on the screen. So real quickly, here's the timeline. I've already talked about the fact that there'll be the awards are $25,000, up to $25,000, but I'm trying to think if I think everyone we've given has been for the full amount. The way that the disbursement of funds for this works is that if you are awarded as a Kickstart awardee, you will get a contract from us. You'll sign the contract and give us a work plan and a budget. And once we've approved those, then we'll disperse the funds immediately. So 90% of the funds will come, as quickly as possible. We withhold the last 10% of the funds contingent on receiving your final report. And that's the only reporting requirement that we'll have. The other thing I want to say is that how many people do we have right now? Oh my gosh, 128 of you are on the call right now. That's the most we've ever had, and that's both exciting but also daunting because we'll have to read all of your applications, which it's a pleasure to do, by the way. I don't want to say that it's not. What I will say is that this year we expect to have a bigger number of organizations funded, up to 15. That's not a guarantee that we will fund 15, but for instance, in our last round, we had 25 applicants and we funded 5. It's our desire to fund everybody who's got a great application, but of course we can't. One thing that we've done in the past is have a conversation with folks who've applied but not been funded. If 128 of you apply, I don't think I'll be able to make that same offer. But the Kickstart project and what we're trying to do with Dash and All In generally is to build up this network of people who are working on this stuff. And so obviously, everybody wants to be funded, both because the money is valuable and because of the fact that being funded by a Robert Wood Johnson funded project has a certain level of validity. So we recognize the stewardship that we have for this opportunity. But because I know that we won't fund all of you, I want to be really clear that we think that participating in the All In network, which I'll talk about in a minute, has some value on its own, because the purpose of the All In network is to make connections to people and resources and lessons. And so for those of you who won't be funded, that will still be an actual valuable opportunity. This also leads me to anticipate one of the questions we might get, which is, if we've applied before, can we, and not been funded, can we apply again? And of course, the answer is absolutely. I would suggest that you not submit exactly the same proposal, because we do expect that conditions in communities change over time. And because we are trying to fund, sort of the things that are really immediate, because it's valuable to you and because it more rapidly assures that we'll have some lessons to learn from you. If you, for instance, were to submit, the same thing that you did for round 1 or round 2, we might ask, really, has nothing changed in the ensuing months? So, again, we got the first question. Don't be shy about asking questions. We'll get to as many as we can. So, there are 2 sets of criteria that we think about in this process. And so the first one is eligibility, and the second one is selection. So eligibility criteria are the ones that you have to meet every single one of them. And then selection criteria are the things where we say, wow, if you are more like this, that's better. If you're less like that, then that's not as good. So just so you understand the distinction there. So I will run through the eligibility criteria at the risk of reading something that you all can read for yourself. The first one is sometimes the question that people have: do I have to be a member of the All In online community in order to apply for Kickstart? And in this case, we do ask that you are minimally involved in All In. That means you have join the platform at allin.healthdoers.org, which is our online community, and you have created at least one profile for an individual person who is the applicant. There's also the opportunity for your partners in this application to create their own profiles and have a collaborative project that sort of ties them together. But I know that all online communities can sometimes be daunting, so we don't want to ask too much. The second eligibility criteria is that we want you to be able to demonstrate that you have relationships that are significant in 2 or more sectors that have a role in this collaborative work or data sharing. And so this is the part where we say, honestly, if you have a desire to create a multi-sector collaboration, you're just getting started, Kickstart isn't for you. One of the significant enabling elements of the environment for successful collaboration and data sharing is the presence of established relationships. And so we don't think that creating relationships simply to apply for a $25,000 grant is likely to succeed or to generate lessons that are so useful. But that's also one of the reasons why we're doing rounds and rounds and rounds of Kickstart, is because we recognize that some communities, a lot of communities, are exactly in that place where they're still trying to figure out, how do we collaborate? How do we start to build authentic relationships? I guess I will go off script for a second here and say, if you are new to this work and you're not exactly sure how to start this process, Dash recently published a great paper on this called the value of multi-sector data sharing. And it's at the Dash Connect site. I think it's dashconnect.org/value. But anyway, that's a great primer on the very, very first things you need to do to get started. So that's that criterion. The third thing is we want you to be able to show that you are in some way thinking about the data sharing. Ideally, you'd have some kind of data sharing activity in place where the Kickstart funds can expand or accelerate or augment or other words like that. But we are looking for evidence that you've sort of thought strategically about how you use data, and so you're either planning or implementing or actually doing the work. We are going to take a look at the problem statement and your work plan, and how you're going to address that with contract funds. Honestly, one of the things that I've learned as we evaluate these applications, is that sometimes the budget tells us, a lot about it. It often tells us a lot about what the applicant thinks is most important, because of course you put your money where your mouth is. So do pay attention to how the budget matches up with your proposal and work plan. The last thing is you have to be a 501c3 organization. Now, I realize that's actually incorrect, or it's not accurate, because governmental organizations are also able to apply. So I'm sorry, we should have changed that slide. That's my bad. So it is, I think that is a question that we successfully answered in the FAQs though. So yes, governmental organizations are able to apply, nonprofits are able to apply, foundations typically can't, private agencies or organizations or companies cannot. Now I will address another one of the frequently asked questions here. I'm a private agency, I'm a consultant, or I'm a vendor, and I work with the local community. Can they apply on behalf of a collaboration that I support? The answer is yes, if they meet the eligibility requirements for this opportunity that I've just gone over. But you'll have to really show that this is an authentic relationship that's responsive to a community problem or opportunity, because we we don't want to just fund a straight pass-through where it's not connected to building authentic community capacity. Whew, I felt like I said a lot on that slide. All right, let me just jump to the next one. The next slide is about joining All In. So as I said before, All In Data for Community Health is the national learning collaboration, 100+ organizations that are part of it. The website that has information about it and has a lot of resources is at allindata.org. We also maintain an online community platform at allin.healthdoers.org. And so I'm sure that a lot of you, especially those of you who have been funded in other learning collaborations, have had to participate in a learning collaboration or a community of practice. And so you will not be surprised at what you find on our collaborative platform. But I think the value for us is that a lot of the learning documentation happens in the online community, and it's our hope that we continue to build up its usefulness to you and to the field by continuing to push our awardees and grantees into the community, because when you create a profile, for example, you tell folks this is who we are, this is what we're doing, this is the population that we're serving, these are the use cases that we're doing. All of that information in your profile then is searchable by other people on the community platform. So if somebody says, I want to do a data analytics project, or I really want to understand how I can pick data indicators to address health equity. We have communities that are working on those things, and you can find them by using the online community. And so that's the value for it. As I said, even if you're not on the online community now, you have to be by the time you do your submitting, because that's something that we'll check. When you apply to join, you'll get a questionnaire to fill out, and at some point you'll be doing a capacity assessment. That's really a later activity, and that's this project. So I'm going to run through the selection criteria. And if you haven't already started an application, I know that we checked this morning, it looks like 8 of you have. So you've seen the application, but we try to make it not too burdensome, either for you to write or for us to read. And we really focus in the written section around the things that make up our name. It's not, and Kickstart, maybe not the greatest name in the world, but it does sort of reflect what we're trying to do. And these are the selection criteria. So you will, in your application, be asked to talk about how strategic and timely and actionable and replicable, a word you wouldn't use outside of this context, or targeted your idea is. And so there's more detail on sort of what those things look like. I'm surprised we don't get more question about what do you really mean by replicable, or what is the specific thing you're trying to find from targeted. If it's not clear to you, please go ahead and ask us. We'll try to answer it. It's my experience that if you have a question, probably other people who are in this process will have the same question. So if you ask a question, we'll answer it for everybody. There's a lot more bullet points on the second thing of the selection criteria. A lot of it is really, I think, fairly commonsensical in that, we're really looking for, have you thought your idea through? Do you have some kind of evidence or way of understanding what's happening? How many of the sectors outside of, your local hospital or public health department do you have? DASH and All In are really interested in the participation of sectors that haven't yet been strongly represented in the field of multi-sector health, because we know that whether you have access to a transportation, public transportation or affordable transportation turns out to be incredibly important for successfully accessing, healthcare services, for example. How do we document that in terms of data? What would a data system look like that would sort of integrate healthcare data and transportation? It's that kind of thing that we're kind of early in this work, and so there are lessons to be learned there. We are interested in understanding how the project that you propose will create benefits for the community. We are very interested in what kind of lessons you are going to experience. Let me use this as also, I really want to say, we don't talk enough in this field or in most fields about the failures that we have or the mistakes that we make or the ways that we get waylaid along the way. And honestly, I get that. My organization is just like yours in that we write proposals to try to convince funders that we're doing something that is valuable and it's something that we can succeed at. Still, not everybody doesn't always succeed. And certainly I can tell you that we haven't always succeeded with everything that we've tried to do with DASH and All In. And so being transparent about the mistakes that we've made along the way and what we've learned from them turns out to be incredibly valuable. So I don't want to say, hey, apply, because it doesn't matter whether you succeed or fail. What I do want to say is that we think there's incredible value in documenting and understanding the ways that well-meaning organizations and people brush up against barriers, because if we can identify those and come up with some solutions eventually, then other people don't have to keep making those same mistakes. I already spoke to that last bullet a little bit in terms of the fact that we will take a look at how the proposal, the application, the work plan, and the budget seem to be aligned. The other thing that is not on this slide, and again, Q, we're going to have to add this for the next time. I know it is in the application. We are very much like so many organizations trying to get a good handle on health equity. And I think that if your organization is either early to the health equity game or you are strongly in it, I think that there's a really important conversation happening right now about how do we take the values that we associate with health equity, how do we take our understanding about health equity, about how health equity is driven by racism and classism and sexism, how do we turn that into program operations? Well, we're interested in understanding the degree to which your project sort of is thinking about that. It's not the sole criterion, but we do recognize that we've all got a lot to learn about how do we make health equity real in our projects. And so there is a question in the application about the participation of people with lived experience, that either whether that's patients or residents or program participants, how do those folks factor into the execution of your project? All right, so that's kind of those are the issues related to how we'll be evaluating your proposal. Let me talk a little bit about what will happen for those of you who will be funded. So the very first thing is that we'll ask you to update the profile on the All In platform to include information about the other people and organizations that are part of your collaboration, and to more fully develop the description of what you're trying to do. That's all about having as complete a picture as possible of what you're trying to do so that other people can find you. You will find that valuable yourself, because you'll be able to find other folks on the platform that might be valuable resources as you try to execute your project. You will have monthly check-ins with project staff from the National Program Office. We scale back on those, and so those typically are only about 45 minutes a month. Our staff is available for more consultation if that's helpful to you, but we recognize that $25,000 awards are relatively small for what you're probably going to be proposing. And so we don't want to make we don't want to make it burdensome in terms of how much you are required to interact with us. But of course we're always available and eager to help you. We just don't want to make it feel like that's a required activity. And that reminds me of something I should have said on the last slide. And it goes to the nature of the $25,000 award. It's my experience that we don't want people to make too little or too much of that amount. The part about making it too little is we recognize that it's valuable, and we've got right now 134 people on this webinar, and so we know that there is a lot of interest in this. And so in that respect, we're going to pick high quality, timely projects that are really going to generate capacity building for the local community and lessons for the national efforts. But I really want to encourage you not to pad your application with more work than you can successfully complete. This is part of what we've learned over the course of 2 rounds of Kickstarts. As people have come on with these really elaborate work plans, and with 3, 4, 5 deliverables and all these outcomes, really, if you're able to clearly and distinctly define 1 or 2 deliverables or outcomes for your collaborative activity, that's what we're looking for. We want you to succeed. We don't want you to think that you have to promise the moon so that we'll select it. We really want your proposals to be reasonable for you to succeed, knowing that stuff comes up along the way, and it's, these projects are not easy, and $25,000 isn't a huge amount of money. That's just a little aside there for you. That last bullet about additional support is, we don't have a requirement for a site visit here for this project. I mean, we're going to have up to 15 of them in 6 months, and we just don't have the staffing for that. But there are cases where that might be an appropriate activity. In that case, we always do the site visit around a community activity that you have planned that's a natural part of your project. We're not going to say, can we come visit you and ask you to do a dog and pony show? We're just not going to do that. So it's not something that's required, but it's something that might be useful to you or to us. And so that's a possibility. We've also got high quality communications capacity here, principally in the person of Jenna Frickovich. And it's really gratifying for me. She has started to get requests from past awardees to help them with nicely designing and executing materials, and so that is capacity here that's available to our awardees. We also have a lot of capacity in our organization to help to document your outcomes. We do a lot of publishing here in terms of papers and webinars and presentations and blog posts. So, if we select you because we think you've got lessons, you're going to generate lessons, well, then we're going to help you get those out. We also, for some of you, will have travel support available to go to conferences to present on your work. It's one of the hallmarks. It's one of the ways that we have done this work in All In, is that every time we present nationally at any conference, we always pick communities to present about what they're doing, and we take communities from different parts of the All In program. And so it'll be a DASH project presenting with somebody from the Public Health National Center for Innovation, or it'll be a build community presenting with somebody from New Jersey. So we do a lot of presentations around the country, and we lean on the communities that are being funded to do this work, because that's really the best. That's really the best advertisement for what we're trying to accomplish. So that will be available, and you'll learn more about that if you're selected. So I want to talk about how to apply, and then we're going to get to questions. I can see we've got a good number of them. Whew. Okay, that FAQ is going to be stuffed. So how to apply? It's important to, we always identify it up front, but we are a fully funded project for the Robert Wood Johnson Foundation. And so even though the money for Kickstart will come directly from DASH, and all of your grants and contracts management will come from DASH, and all of your reporting and monitoring and encounters will come from DASH, we use the RWJF system to do the applications. They've already got a really nice system for people to apply. It's highly customized. They are great. They're great people to work with. So just so you don't get confused, if you go to dashconnect.org/kick-start, you'll see the link to the online application system. That is the RWJF system. If you don't already have a login there, you'll have to create one, but then you'll just go through the process. All of the sections that you're going to have to write about will be in that system, and even though there's a lot of stuff there, I promise you, if you've ever done an online application, you'll be able to follow it. And of course, our staff is ready to help you if you have problems. And so you'll have to enter contact information. You'll have to add information about your organization. There'll be text fields for a project summary. You'll have to answer questions about the eligibility criteria, which are the ones that we just went through. There's a bunch of project information questions. You'll fill out the budget, and then any support documents, whether you want to include. Well, actually, some of them are required and some of them are optional. The deadline for that is always shown on, let me just, I went too fast, or I didn't print out that slide. Okay, so I'm gonna run through these again at the risk of saying something to you that you can certainly read on your own. This is the deadline. It's 3:30 p.m. on November 16th Eastern Time. I have never, actually it's not true. You should make sure you've got your application in by then. It's only under the most extraordinary circumstances that we would let somebody in that didn't successfully apply, and an internet outage on your end isn't enough of a justification. So I don't want to be harsh about this, but it's really important that you meet that deadline. That's why you should, to the extent possible, do as much of this stuff early on. We do have an email address, info@dashconnect.org. If you have any problems, if you do have a problem, contact us as soon as you do. That will, help us to help troubleshoot it. You can do it. You should do it online. You can draft questions offline if you want, but the application is online. And I always said, please get it done ahead of the deadline. The other thing is, and I've made this mistake before, where you start an application and you realize you didn't do it in the way that you expected, and so you want to start over. Please don't start over. Everything is editable until you submit it. And so we'd like just to see one application per organization. Inside the system, there are places to save it often. That will make your life so much better. And then at the end, you have to hit submit. If you just save, it won't be submitted. And then, of course, if you are not 100% sure that you, the person who's going to submit, will be available, please make sure that you've got some help. Okay, so that is, man, I have not talked this long straight for a long time. But I also feel like this is the best description we've ever given. So I'm just going to start going through the questions. Oh my gosh, Q and Melissa, you guys have done a great job of already answering some. So I'm going to start with the questions that haven't been answered yet. And then I'll circle back around to the ones that have, because it looks like we've got about 20 questions so far. That's really terrific. Thank you so much. Okay, so I'm going to read the question, then try to answer it. If you are not yet a 501c3, but are in active application process, can you apply? Or must you have a definitive 501c3 status at time of the application? So this is kind of a judgment call for us. One of the things that having the 501c3 status, that's a legal designation, but it also shows that your organization has gotten to that point in its development that it's official. But it may be that you've had a demonstrated, documented history of working together, and that you can point to. So I guess in this case, if that's, why don't you write more about that and your situation, and send it to info@connect.org, and we'll see. I mean, because that 501c3 issue is really important for us and for RWJF, because RWJF is also a tax determined, I don't know what their exact number is, but one of the ways that they maintain their status as a foundation is by only giving money to government and not-for-profit. And so they're legally restricted in that way. So write to us and we'll see if we can't figure out. The next question, if we are a nonprofit that has a fiscal agent with a project fee indirect rate, is this allowable under this grant? You're a nonprofit that has a fiscal agent with a project fee. So I think the question here is indirect allowed as a part of the funding? So Data Across Sectors for Health follows the guidelines of Robert Wood Johnson in terms of what is or is not allowable. And so indirect costs are an allowable part of the grant. I just want to highlight the fact that we know that $25,000 is not a giant amount of money. And so if you were to apply a significant indirect rate against the $25,000, we would wonder if you have enough resources set aside to actually execute the project. So let me just say, so I hope that's responsive to your question. If it's not, send a note to info@-connect, and we'll try to follow up with you. Can the funds be used for data systems programming staff time? Yes. Again, that's an allowable, staff time is an allowable use of funds. Again, I would say a couple of things about this. One is that you want to tie, as I said, the use of the budget for programmer time to the demonstrated objectives of your work plan. So they need to be tied. The other thing is that if you're using this for external consultants, that's easy for us to understand how the work product of an external consultant would do the thing that you said it was going to do. If you were using it for internal programming time, you want to make a good case that this is something that's in addition to what the programmer who's already there would have done without the funding. All right, I'm going down to the bottom of the list. These are the last two questions that came in. Oh, wait a second. No, there's an important one above it. What should documentation of a multi-sector shared data project look like in our application? Letters of support, MOUs, other documentation? Yes, those are all good things. Over the course of the 4.5 years that we've been running DASH, and we have some sense for what authentic multi-sector collaborations look like. So So we will have a frame of reference for your application. So that's the good news. The bad news is that, not the bad news, the part that I want to point out here is that we don't know probably your local context. So you're going to have to explain, why what you're doing is multi-sector. You're going to have to explain to us why it's concentrated in a local community. And you're going to have to tell us sort of what are the sectors that are involved in the data sharing or would be involved in the data sharing. So some of that will come up in your application text, but you can definitely document that with letters of support and MOUs. I've done a lot of proposals and gathered letters of support, and I know that they are both real and they can also be things that aren't particularly compelling. So we are much more interested in the documentation of authentic existing relationships than sort of, saying, oh, we've got 10 different sectors involved in our collaboration, when they're really not an active part of the governance or the data sharing. All right, before I answer, I saw one question that's been answered, but I want to make sure that we highlighted it. Somebody asked the question, how do you define sectors? And so Q has already answered this, but there is information about this on the Kickstart site, but also inside the application, you will have the opportunity to identify what sector you represent. And so we've done a lot of work on saying what the different sectors are. So generally, think of the sectors as the collection of organizations and people and expertise that are around doing one thing. So for our perspective, transportation is the sector. Education is the sector. Maybe it's two sectors. Maybe it's sort of, elementary education and college education, but education is the sector. Housing is the sector, or you may think of housing and homelessness as the sector. So when we talk about sectors, we talk about that. The folks who are operating in a certain set of professional expertise. All right. I am going to need to gargle after this is all done. So we have a question, would a foundation be eligible to apply on behalf of a community collective impact initiative? I don't think a foundation is eligible because I don't think it's legal for a foundation to give money to another foundation. I could be totally wrong on that reason, but I do know that that a foundation is not eligible for this opportunity. However, my answer to the question earlier still stands. If one of the members of the community collaboration is available, meets the eligibility criteria, they can apply on behalf of the collective impact activity. And in fact, that's probably would be better. I know we've got an FAQ about who should apply. If you have a community collaboration with a bunch of different organizations, who should apply? And our answer to that is the application should come from the organization that is most responsible for executing the activity. It sounds kind of straightforward. So when in the case of a fiscal agent, you'll just have to explain to us, why the particular organization is the one doing the application. All right. Will there be any challenge with teams submitting applications for programs that are similar in nature to previously funded projects? That is a great question, and I want to apply a little nuance to it. Because I talked about the three different purposes for the Kickstart at the top of this webinar. And, two of them are, we want to develop capacity at different communities to do this multi-sector data sharing work, right? So that's a value for us, and that's something that we want all of our funded applicants to do. At the same time, we want to learn some new things. So we might have a community that we funded before that has really got a new idea, or a community or an organization we funded that has got something that's truly new. They're integrated in a new sector, or they're trying a different, they're adding on to a data system, or they are, working with a new population. I mean, those things are new, and it would be create valuable lessons for us. On the other hand, we might have a community that's brand new to us, that's tried to do something that we already know quite a bit about, and so that would be less appealing. So all things being equal, if we had two proposals that were proposing exactly the same thing, and we found both of them to be worth funding, we'd probably go with the community that we hadn't funded before, because we're trying to spread the wealth around. We can't fund everybody, so we've got to be kind of strategic about this. So I'm sorry if that's not a perfectly straightforward answer, but the final selection process is a little bit science, in that we had all of these objective criteria, and a little bit art in terms of we're trying to assemble the best collection of communities that can build the field in a way that we are responsible for. Good luck to my colleague who's trying to craft an answer out of that. All right. I see another one. Logged into RWJS to check this out, and I see an ID. Does this mean started an application? I do believe, Aroma, that's ID. Then I think that you have started an application. For sure, it's try to save it. If you can't save it, then you haven't started. But if you have, I mean, there is an ID associated with this opportunity, but there's also an ID associated with your application. So I would say try to save it. Another new question: to get a feel for how competitive the grant is, can you give us a ballpark of how many organizations have applied in previous rounds? Thanks. Great question. So in the first round, we did it as a pilot where we only invited people that we already knew. And so I feel like we got 15 or 14 applications, and we funded 5 of them. For round 2, we got 25 full applications, and we funded 6. So I imagine that we're going to get more applications this time, but we're also going to fund more of them. So right now, there's still 115 of you on the line. If we got 115 applications, wow, that would be a wow. But if we decided that at least 15 were worthy of funding, then that would be 15% or so. Would you fund a program that is similar to another program previously funded by DASH, i.e. implemented an evidence-based program that is already funded in another geographic region by DASH? Again, I think my earlier answer sort of applies here. We now, through DASH, but also if you count all in, I mean, we've now funded communities. We've funded 20 different communities around the country, mostly metropolitan, but some rural, one a Native American tribe. So we've gotten around already. So I don't think the fact that we funded something in a geographic area is not necessarily, that doesn't work against an applicant for this round. I think it's more about, what's the capacity that's being built that wasn't there before. That will be really the capacity that will be built, and what are the lessons that we can learn and share with other communities. Out of curiosity, have you been approached by health systems that utilize Cerner as part of their DASH project? We have funded projects that include health systems. I don't remember off the top of my head whether the particular vendor for their EHR has been an issue. And so I can't say for sure whether we have or haven't. so yeah, so I'll just answer. I'll leave it there. Again, and we'll, Roma, you can throw the last slide up there, just so we have it. If you go to dashconnect.org/kick-start, that's the home for this program. That's where that's where the link to apply is. That's also where the FAQs are currently posted, and they will be updated based on the answers that the questions that you asked and the answers that we gave. That will all be updated there. You can see information about the past grantees for DASH. You can see our original DASH grantees, the 10, and then you can see the grantees represented by the first 2 rounds of Kickstart. You can also, I think this is really interesting, at the allindata.org site, if you go to community projects, there's a paragraph about every project that has been funded by the All-In partners. And so, again, if you're new to this work, you should find that really interesting. You know, we really operate in this learning collaboration around the idea that the wisdom is in the room. And so for us, you know, we're trying to make the room smarter and more experienced and more diverse, more focused on health equity, more focused on getting more sectors involved. And so we're trying not to say that we're all about the bleeding edge, because we're not. There's other places where that happens, but we are interested in solid applications for communities that know what they want to do, and what they want to do will generate lessons for the field. I feel like we've answered all of the questions, and it's 3 minutes to the top of the hour. Oh wait, is that no? Oh, we have one more. Okay. Well, Dash Fund, I think you mean fund, but we try to be fun at Dash. Will Dash fund the purchase of the data platform if the community collaborations work plan are solid? Let me answer that this way. That is an eligible use of the funds. The thing that we'd be interested in seeing, and we have funded something like that before. And I don't say that because I want to say, well, we funded one data platform, so we wouldn't fund anymore. I'm not saying that. I'm saying that is an eligible use of the funds. What I do want to say is that it's our experience, and the experience of most communities, that the technology is not the answer. The technology is a tool to get to the answer. The technology properly deployed by a real credible community collaboration is a tool for change, for systems change. And so if your proposal is, hey, you know, we want to buy an information referral product and hook it up to the local hospital, that's not compelling. What's compelling is we want to do these activities that generate this change in the community. And we think that this tool that's available is going to accelerate our progress, you know, and this is how we think what we learn will be valuable to the field. That's the compelling part that we're looking for. All right, I don't see any new questions that we haven't answered. So I just want to say, again, thank you so much. I know that it's tough to apply for funds. I know it's disappointing when you're not funded. And I'm 100% convinced that we will have more ideas that are worth funding than we'll be able to fund. But I want to say that I hope that you do feel like this has given you information about the best way to apply, or whether you should wait, or whether this is for you or not for you. And I want to put in finally, encourage you, if you haven't already, to take a look at joining the All-In community, because there are things of actual value there. in addition to this opportunity. I want to say thank you. I think there's an evaluation that's going to pop up at the end of this. Please take a minute and fill it out. I know that I've talked myself hoarse over the course of this, but there's a whole bunch of really smart and dedicated people who are a part of our team. And so on behalf of Claire Tanner from Michigan and all of the rest of us, we're very grateful for your interest in this opportunity. Thanks very much.